And in your morning medical news, roughly 200 pharmacists took to the Iowa State House yesterday, asking for lawmakers to push to bills that would help improve healthcare access in the state. The group is pushing for the passing of two bills that would stop pharmacy benefit managers from paying pharmacies less than the cost of a prescription. They also say that if passed, the bills would help give patients more freedom on their prescriptions and help keep pharmacies from closing.
The PBM model of take it or leave it contracts limits patient choice, forces local pharmacies to lose money when providing care and prescriptions to Iowans, and drives pharmacy closures across our state.
Opponents of the bill say if the bills do pass, the public would have to fork up the difference. The move comes just a year after 29 pharmacies closed across Iowa. Just last week, experts from leading health organizations released new guidelines calling for no caffeine for kids under 18. But a new study says exposure to caffeine energy products have significantly increased in children and teens in recent years, but not always on purpose. Mandy Gaither looks at the research and explains why this kind of exposure is skyrocketing.
The full impact of caffeine on children is still unknown, but it is clear the substance isn't healthy for their developing bodies.
The most common clinical effects that we saw in our study were agitation, nausea, vomiting, and fast heart rate.
Dr. Hannah Hayes is co-author of a new study published in the Journal of Medical Toxicology. She, along with researchers from Nationwide Children's Hospital, found a 17% overall increase in caffeine energy product exposures in children and teens, which were reported to U.S. Poison Control Centers between 2011 and 2023. The exposure rate to caffeinated liquids, such as energy drinks, rose 35% in that time period, and that rate for caffeine powders, like ones taken before exercise, skyrocketed 633%.
I was surprised that almost 70% of the exposures in our study were in children under 6 years of age.
Hayes says those surprising results may be due to the increased availability of these products and colorful packaging, which can be attractive to young children. They're also naturally curious and enjoy exploring their environment, or may see adults drinking these beverages and want to try them. She says the best way to keep children safe from unintended caffeine exposures is to not have them in the house.
However, if you do choose to keep these products in your home, you should store them in a safe place away from children.
And while most cases reported to poison control centers weren't severe, researchers found some kids did face serious complications. 22 patients had seizures, with some requiring hospitalization.